Much. We go on to our next speaker, Dr. SHAFEENA, who is going to be talking on eye respirator, just push, and I request Dr. Shakeen Singh to be the discussant for this. Because Dr. Kamaljeet Singh is not here.
Good morning all. I will be talking about EYESPIRATOR, a novel aspiration tool. In surgical practice, it is important to have a clear and bloodless surgical field. So the need of suction apparatus is important. As ophthalmology as a surgical field have minimum amount of blood loss, as in cataract surgery less than 5 ml and in orbital surgery about 75 ml. But the delicacy of the tissue and small amount of the blood is the challenges for aspiration of the blood. So, and also pooling of blood and fluid in deep sockets and the bleeding that obscure the view, especially in orbital surgeries, which need deep tissue access, are the challenges faced by surgeons. Over years, there are many aspiration tools invented like angiosterometer, manually operated aspiration tool, and electric suction pump. But the drawbacks are the suction pressure is very high and also the suction tips are very large, which is difficult to maneuver in small surgical field. EYESPIRATOR is a innovative tool which is meant to solve these problems. It is an easy, do-it-yourself, cost-effective and efficient tool for aspiration of small amount of fluid and blood in the operation field, and it can be made using recycled and easily available components. It is made using a foot pedal, a DC adapter, a DC water pump, an intravenous set, a collection bottle, and a bottle stand. So how does it work? It works by direct current which is connected by an adapter, and this adapter is connected to a foot pedal which acts as a on and off switch. And this foot pedal is again connected into a self-priming aspiration motor, and the aspiration end of the motor is connected to a tube which is connected to the collection bottle through an opening, and which will create a vacuum inside the bottle. And the bottle has another opening to which the IV set is connected, which will aspirate the fluid and collect inside the collection bottle. The other end of the IV set can be used in the surgical field. And we also tried using this instrument in the operation theater. This is the adapter which is connected to the foot pedal, which is controlled by the assisting sister. And this is the motor which is connected to the suction bottle, collection bottle. This bottle is a used normal saline bottle. And we found that the suction apparatus aspirator is effectively aspirating the fluid and blood from the surgical field, which improve the view of the surgeon. Which will improve the surgical efficacy and also decrease the time of surgery. The advantages are the aspiration can be controlled effectively by foot pedal as and when required, apart from the conventional aspiration tool which is permanently on all the time. And the the drip set end is very small and flexible, which can be easily maneuvered in the small surgical field. And new IV set can be used for each patient, which will avoid the need for sterilization of the whole apparatus for each patient and also avoid cross infection. And the entire apparatus can be sterilized by ethylene oxide, and it is cost effective. The entire apparatus cost less than 1,500 rupees. And it can be used for cataract surgery, especially when there is pooling of fluid during cortex aspiration in deep socket, and also for dacryocysto-rhinostomy, dacryocystectomy, excision biopsy, orbitotomy, and evisceration. These are my references. Thank you. Sir? Not required. Actually, the IV set tube itself will work.
The discussant for Tanya is